A 25 years old lady present to the medicine OPD with complaints of abdominal discomfort and malaise. She has high-grade fever of 101 degree Fahrenheit for the last 3 days with a coated tongue and mild splenomegaly. We have to remember the fever is for last 3 days and the presentation are coated tongue and mild splenomegaly, and her blood is sent to culture and sensitivity. Identify the organism. Here two discs are kept. The first is on McConkie agar. We get pale or colorless colonies on McConkie agar, that is, they are non-lactose fermenting colonies. So it is clear that non-lactose fermenting colonies are get on McConkie agar. Then on XLD we get red colonies with a black center, that is the red colonies with a black center. XLD means xylose lysine deoxycholate agar. So it is clear we get red colonies on XLD with a black center and non-lactose fermenting colonies on McConkie agar. The black centers on XLD are due to the production of H2S gas by the organism. Then about biochemical reactions. We get indole test negative, so the purple ring is absent in indole test. Then citrate test is also negative. Then urease test also get negative, that is yellow color. Then TSI. In triple sugar ion media we get K by A with H2S production. On the left hand side we get an inoculated tube and the right hand side we get the inoculated tube. Here the slant is pink in color, that is the slant is alkaline, and the butt is yellow in color, that is acid in nature. So alkaline slant and acid butt. Then we get an black color on the slant, that is a black streak line. It indicates the H2S production. It is very narrow in this case, and more H2S production is seen in Proteus species. So in TSI we get K by A with the H2S production, that is alkaline slant by acid butt with the H2S gas production. Then about mannitol motility. On the right hand side we can see uninoculated tube, on the left hand side we get inoculated tube. So the organism is mannitol fermented due to the yellow color, and it is motile due to absence of central streak line. So it is mannitol fermented and motile. With this we identify the organism as Salmonella typhi. So from the biochemical findings and cultural characteristics we identify the organism as Salmonella typhi. Then what is the most suitable test for the diagnosis in this patient? The duration of the disease is 3 days. So it is good to do a blood culture. In the first week blood culture have a 90% sensitivity. So also clot culture or antigen detection can be done in first week. Then what are the treatment options? Fluoroquinolones like ciprofloxacin or ceftriaxone or azithromycin can be given as the treatment in enteric fever. Then how can you detect the carrier stage in this infection? We can detect the antibodies against VI antigens specifically. Then culture of stool, urine and bile samples. So the repeated culture of the stool, urine and bile sample should be done. Then about sewer swab culture. It is another method to detect the carrier stage in these infections. So these are the methods to detect the carrier stage in this infection. Then mention the vaccine available. We have TAB vaccine, typhoral vaccine and VI polysaccharide vaccine. The TAB vaccine is a trivalent vaccine and the typhoral vaccine is an oral vaccine. Then VI polysaccharide vaccine is injected intramuscularly.